Okay, so I just got this idea as I was filming my What's in My Medication Bag EMS style. Essentially just going to be a rapid review of these medications and what their indications are. Now, obviously we know that scopes of practice vary a lot from area to area, right? So if I don't say an indication that you're allowed to give the medication for, feel free to drop it in the comments. Or if an indication that I list is not permitted in your area, just let me know in the comments. That way we can kind of highlight how different scopes really are around the country and the world. Okay, first we have aspirin, and we give this for chest pain when we suspect it's from a cardiac origin. And then we also give nitroglycerin for the very same thing, but as we get up into the medic scope, this can be given for congestive heart failure with severe pulmonary edema. Then for our antiemetics, we carry Zofran, or ondansetron. It's given for nausea and vomiting, and Phenergan is given for the same indications for nausea and vomiting. Now, typically the rule of thumb that we learn whenever we're in school is that Zofran is typically more useful prior to the vomiting, just the nausea feeling, and Phenergan is pretty effective once the vomiting has started, but they can be given for either indication. Then we have amiodarone, and amiodarone can be given on a live patient when we have wide complex tachycardia, irregular or regular, and it can also be given during the course of a cardiac arrest when the patient has ventricular fibrillation or ventricular tachycardia. Then we have adenosine, and adenosine is given also for very fast heart rate, but it's given in the case of narrow complex tachycardia. Typically regular narrow complex tachycardia is when we give adenosine. Okay, now we have epi. We give epi for a multitude of reasons, right? We have epi 1 in 10,000 that we give during the course of a cardiac arrest call, but we also have epi 1 in 1,000 that can be given during the course of anaphylaxis, a bronchospasm, asthma attack. We can also give epi for bradycardia, for shock. Epi can also be nebulized for croup. Okay, and then we have magnesium sulfate, and I'm a big fan of magnesium sulfate, or really any medication that has multiple uses. But magnesium sulfate can be given for eclamptic seizures, preeclampsia. It can be given for COPD exacerbation, asthma attacks, torsades. It's a cardiac rhythm or an abnormal cardiac rhythm. And it can also be given whenever seizures are refractory to benzodiazepines. And then we have Lasix. Lasix is given in the case of hypertensive crises, specifically with fluid overload like CHF exacerbation, acute pulmonary edema. Then we have calcium gluconate, and where I'm from, we give calcium gluconate for calcium channel blocker overdoses and magnesium sulfate overdoses. Atropine sulfate, and this is given in the case of bradycardia, symptomatic bradycardia. We also give it for nerve agent exposure, organophosphate poisoning, mushroom poisoning, that sort of thing. And in our scope, it says that we can give it as an adjunct for bronchial asthma, Narcan, and we give this for narcotic overdoses, but specifically with respiratory depression. We don't just give this kind of willy-nilly whenever somebody has OD'd on narcotics or we suspect that they've OD'd on narcotics. Respiratory depression needs to be present as well. And then we have D50, give this for hypoglycemia, but we also carry D10, and this is actually new for the department, but we carry D10 and we give this for hypoglycemia as well. And then we have glucagon, and glucagon can be given for hypoglycemia. It's an intramuscular injection. Can also be used for beta blocker overdoses, calcium channel blocker overdoses. It can also be given in anaphylaxis that's refractory to other treatments like epi, or in the case of a patient that is on beta blockers or something that's antagonizing the epi, glucagon is an option for that too. And then we have oral glucose. It's going to be the first thing that we try whenever we have a hypoglycemic patient if they're able to protect their own airway. Then we have sodium bicarbonate, which we can give in the case of an overdose of tricyclic antidepressants, also a phenobarbital overdose. We can give it in the case of hyperkalemia. Obviously, we would need to know a little bit more before we did that. And then suspected cases of metabolic acidosis. And it is in our scope still indicated is prolonged downtime during cardiac arrest. And I forgot a few. We have Benadryl, and it is given for allergic reactions, anaphylaxis, or a dystonic reaction. And then we have Atrovent and albuterol. So they actually have the same indications. It's usually wheezing that's associated with COPD, whether it be chronic bronchitis, emphysema, or asthma, or even in some cases anaphylaxis.